Hi, my name is Lisa. I'm going to be your nurse for today. How are you doing today, sir?
Fine.
Fine. Okay, just real quickly, can you verify that this information is correct? Your birthday is August 27th, 1953,
Correct.
and you'll be 60 years old this month?
Correct.
Okay. What is your reason for seeking care today? What is your chief complaint?
Pretty good cough. Morning cough.
Okay. In the morning time only?
Once in a while at night, but mostly morning.
Okay. Do you have any pain when you cough?
Some soreness at times.
Okay. Is there anything that alleviates? Do you take any medication?
Cough medicine sometimes.
Okay. All right. Is there any smoke in the environment or anything that may bring the cough on?
No, no smoking in the house. None of us smoke.
Okay. All right. When you're coughing, do you have any mucus? Does any mucus come up?
There's some mucus.
Okay. Does it tend to be thick, yellow, green, or is it just
No,
clear?
sometimes it's thick, but it's clear. I mean, maybe a little yellow, but clear most of the time.
Oh, okay. All right. Well, let's just discuss some of your past medical history. Your general health, would you say you're in a good state of health?
Pretty good.
Yeah. Do you have any medical history of high blood pressure, diabetes, cancer, any heart disease?
I have high blood pressure and high cholesterol. I had open heart surgery 9 years ago.
9 years ago, okay. Right. Do you take any medications on a daily basis?
I take Toprol every day.
Toprol. Okay. Do you know the dosage of that?
50 milligrams.
50 milligrams in the morning or at night?
In the morning.
Every morning. By mouth, correct?
By mouth, yes.
Okay. Anything else?
Plavix?
Plavix. That's since your heart surgery?
Yes.
Okay. How many milligrams?
50.
50. Okay. And that's in the morning?
Also in the morning, yes.
By mouth.
Mm-hmm.
Okay. Anything else?
I take an aspirin every day.
A baby aspirin or a full?
No, a baby aspirin.
Okay. So that's 81 milligrams?
That's correct.
By mouth every morning?
Yes.
Okay.
And I
Anything
take
else?
a multivitamin.
A multivitamin. Okay. Your past surgeries, just the open heart surgery?
I had knee surgery when I was young, but just open heart surgery was the big one.
Okay. Have you had any recent hospitalizations or just the heart surgery about 9 years ago, you said?
That was it, yep.
Are you up to date with all your immunizations?
Yes.
Yes. Do you typically get the flu vaccine every year?
Every year.
Every year, okay. And how about the pneumonia vaccine? Have you ever had that?
Twice.
Twice, okay. They probably recommend that because you have the heart history.
Yes.
Okay. We typically recommend people get that every 5 to 10 years after you're 60. So it's good that you have that. Do you have any allergies to medications, foods, latex, iodine?
No allergies.
No allergies.
Seasonal, but no allergies for like food or anything.
Okay. All right. As far as your support system, do you have a good support system at home? Who do you live with?
I live with my wife and my daughter.
Okay. And do you feel safe at home?
Yes.
Okay. All right. So your medications we went over. So I have your health history. Now, how about your parents? Are your mother and father still alive?
No, they passed.
Okay. Do they have any extensive medical history?
My mom was 14 months in a nursing home before she passed, and really it was she had heart issues and she had a stroke.
Okay. And how about your father?
My father was sick 3 days, and they found out that he was loaded with cancer.
Okay. Do you know the primary source of his cancer?
No.
No. Okay. And do you have any siblings?
I have a brother.
Okay. And does he have any health issues?
He had open heart surgery 9 months after I had mine.
Okay, so you both had open heart surgery.
Yes.
Okay. All right. Well, as far as you, how are your health habits? How do you eat? Do you eat well? Do you eat well balanced meals? Do you tend to snack a lot?
I eat breakfast, lunch, and dinner every day, and I snack at night.
Okay. Do you smoke cigarettes?
No.
Do you partake in any illicit drug use?
No.
No. Okay. Do you drink alcohol?
Yes.
How often?
Once a week,
Okay. And how much do you drink?
1 drink.
1 drink. Okay. And at your occupation, are you in any type of environment where you may be exposed to any toxins or?
I'm in the sales office all day.
Okay. All right. So, do you typically go to a doctor? When was your last physical exam?
I get a physical every October,
Okay.
and I just recently visited the heart doctor 2 weeks ago.
Okay, so you have a primary physician and a cardiologist?
Yes.
Yeah. Okay. And then do you partake in prostate exams and testicular exams? Do you do them on yourself? Do you have them done by the doctor?
Once a year at the doctor's.
Okay. All right. Um, Anything else you'd like to speak with me about regarding your current state of health?
No.
No? Okay. Okay, just as we're continuing this, please verify that this is the correct spelling of your first name and your last name.
That's correct.
Okay. So I'm just going to go over some of the systems in your body, ask you some questions. Have you had any weight gain or weight loss greater than 5 pounds recently?
No.
Okay. How's your sleeping pattern? Are you typically tired and lethargic throughout the day, or you feel well rested?
I'm pretty good during the day. By 10 o'clock, I'm done.
Okay. Your skin looks dry and intact. Do you have any lesions or bruises or any type of skin rash?
No.
No? Okay. Do you wear glasses?
No.
No. Okay. No contacts?
No contacts, no reading glasses.
All right. And how about your hearing? Can you hear okay?
I hear fine.
Okay, that's good. I know you say you have the sore throat. Do you have any sores in your mouth?
No.
On your gums?
No.
And teeth? Do you have all of your own teeth?
Some caps, but mostly my own teeth.
Okay, and you visit a dentist regularly for cleaning?
Every 6 months.
Every 6 months, okay. Any thyroid issues, any lumps, anything on your neck?
No.
No. All right. You have a cough presently, but are you typically short of breath on exertion or when you're just laying still? Are you ever short of breath?
When I work out, I'm out of breath sometimes, and if I do, 2 or 3 flights of stairs, yes, but no other time.
Okay. I know you've had some heart issues in the past. Do you ever have any chest pain or tightness in your chest?
No.
No, and you have never been told that you have gallops or a murmur, no irregular sounds in your heart? No. And your EKGs and stress tests have been normal?
Yes, and I get a stress test every 18 months.
Okay. So as far as your gastrointestinal and your urinary systems, have you had any nausea, vomiting, or diarrhea in the past 24 to 48 hours?
None.
No? Okay. When was the last time you had a bowel movement?
This morning.
This morning. Okay. How about urination? Are you having any difficulties voiding?
No.
No. Okay. And you go regularly?
Yes.
Do you drink plenty of water throughout the day?
Yep.
Yeah. Okay. So there's no colon problems either?
No.
Your appetite is fine?
Yes.
Okay. So basically your main complaint is just this dry cough you come in with?
Yes.
Okay. Do you have any other pain or discomfort in any joints or muscles on your body?
Sometimes, the back hurts, the knees a little bit, but no, nothing major.
Okay. And neurologically, I know that you're alert and you're oriented. Do you know what year it is?
Yes.
What year is it?
2013.
And do you know who the president is?
Yes.
Who's that?
Obama.
Okay. And do you know where you are right now?
Yes.
Which hospital?
Yes.
Okay, good. You've never had a seizure or any episodes of like delirium? You've never forgotten any
No.
lapse of time? Okay.
No.
Have you ever experienced any anxiety, depression? Have you ever had any suicidal thoughts?
No.
No. Okay, well, that's good. Okay, thank you for your time. I'll be coming back in just a few moments to do a physical exam on you, okay?
Thank you.
All right, thank you. Okay, Mr. C, we're going to continue this examination. I'm just going to be looking at your head and your neck. I'm going to do an examination of your head, neck, eyes, ears, nose, and throat, okay? First, I'm going to observe the position of your head. Everything seems very symmetrical. Just sit up straight for me. Okay. There's no edema. You haven't had any complaints of any pain in your facial area, right?
No.
No. Okay. No tics, no spastic movements. Everything seems to be intact. No deformities, as I can see. Let me just notice your skull shape. Okay. Can you put your head down for me? Okay, no deformities. There's some hair loss pattern right here. Okay. Okay, now I'm going to palpate your temporal arteries. Okay, there's no hardness here. Does this hurt when I touch here?
No.
No. Okay. And then open and close your jaw for me. Okay, we're just testing this joint to see if you have any TMJ. Is there any clicking or pain when you chew?
No.
No? Okay. Everything seems to be intact with your the beginning of your head and facial examination. Okay, what I'm going to do next is inspect your neck, your range of motion and the symmetry in your neck.
Okay.
Can you just bend your neck forward and backwards and hyperextend your neck for me? Okay, can you swallow for me? Okay, there doesn't seem to be any deformities. Can you turn your head to the left? Okay, we'll notice the muscle here. And now turn it the other way. Okay, and symmetrical on both sides. Let me see the symmetry of your trachea. Can you put your head back? Okay, and there's no bumps. There's nothing protruding. And let me see any fullness at the base of your neck. Okay, so there's no abnormalities, no skin folds. Your neck is intact, slightly short. Let me see if there's any, there's no distension in your jugular veins. Okay, and nothing is sticking out or prominent. So range of motion, you're able to move well. Is there any pain when you move your neck?
No.
No. Okay. I'm going to just examine your muscle strength. I'm going to put. Okay, so what I'm going to do is put one hand on your cheek, and I'm going to test the resistance and the strength in your neck. So try to push against me. Okay, and now try to push the other way. All right, good. And now what I'm going to do is palpate your trachea. Okay, I'm going to be comparing spaces on both sides of your neck. Everything seems to be intact. Now can you swallow for me? Okay, and that feels fine too. Okay, what I'm going to have you do now is take sips from a cup of water so I could examine your thyroid as you swallow. I'm going to notice particularly if there's any tenderness or any nodules or any goiters while you're swallowing. First I'll do it as a frontal approach, and then from behind you I'll also feel the same thing just to see if there is any abnormalities. Okay, so here's a cup of water. Okay, let me just palpate here. Okay, so put a sip of water in your mouth and just hold it in your mouth. And then when I have you swallow, okay, swallow. Okay, good. So I feel no nodules, symmetrical again on both sides. And we're going to do that one more time, but with me behind you. Okay. Go ahead, swallow. Okay. So everything feels fine there. Is it tender when I press on your trachea?
No.
No. Okay. Okay, so as I stated, there's no nodules that I felt, and your thyroid was small, as it should be, and pliable, and it felt very smooth. And I don't believe that I need to listen to it for bruise because it did not feel enlarged at all. Okay, so I'm just going to feel your lymph nodes right now to see if there's any swelling. Is there any pain? Do you have any pain in your ears?
No.
Okay. Any pain when I press here?
No.
No swollen lymph nodes back here?
No.
Okay, the next thing I'm going to do is inspect your ears.
Okay.
Can you just turn your head? So everything seems to look normal. There's no lesions. There's no discharge. Do you ever have discharge? Do you clean your ears regularly?
Mm-hmm.
Okay. And you don't have any discharge?
No.
Okay, there's no lesions. What I'm going to do now is just look into your ear. I'm going to pull up and back on your ear. Okay, everything looks normal in there. Everything looks normal on both sides. Okay. So the test of looking at your eardrum, both of your eardrums look shiny. They look intact, and you're saying there's no pain. And based on our examination so far, I'm able to see that you can hear me well at this distance. But right now I'm going to perform a whispering voice test. And I'm going to whisper one word into each ear, or 3 words, and see if you can repeat them back to me. Okay? So I want you to hold one ear closed by pushing this membrane in.
Okay.
Okay. I'm going to go about a foot away. E, 5, 6. Okay, did you hear what I said?
Yes.
Can you repeat what I said?
B, 5, 6.
Okay, and now on the other ear, C, 6, 7. Did you hear what I said?
Yes.
What?
C, 6, 7.
Okay. Okay, we're not going to need to do the tuning fork test because so far your general screening has been normal and gone over well. And using the Romberg test, you were able to stand on one leg and you never got dizzy and you were able to show you had well balance. So that shows that your cerebellum is intact and you weren't dizzy, you didn't feel like you were going to fall at all?
No.
No, okay. Well, okay. So that's going to complete the examination of your ears and your balance. So now I'm going to inspect your nose. Are you able to sniff? Go like this. Okay. Well, that's good. That shows that there's no obstruction in your nose. You don't have any drainage or anything?
No.
No mucus coming from your nose. Okay. Have you ever been told you have a deviated septum?
No.
No. Okay, so I'm just going to look at your nose and make sure that each nostril is symmetrical. Okay, put your head back. Okay. Looks good on both sides. Do you ever have bloody noses?
No.
Okay. I'm just going to palpate right here, and you just let me know if it hurts or if it's tender at all. Any pain?
No, none at all.
Okay. Next, I'm going to inspect your mouth. I'm going to look into your teeth, your gums, your tongue. Okay. Can I just put your bottom lip down? Okay, I see your teeth. They're all your teeth. They're intact. Can you stick your tongue out for me? Okay. There's no mucus. It's symmetrical. I look back. Okay, you still have your tonsils. They're very, very small. They're not discolored. So you're having some coughing, but I guess not really any throat pain.
No.
Okay. And your uvula is present also. You don't have any bleeding of your gums, no gingivitis, anything
No.
You've never been diagnosed with. Can you stick your tongue out and then go like this? Show me like range of movement with your tongue. Okay. All right. Okay, right now I'm going to further examine your mouth. I'm just going to look at the roof of your mouth and the different palates in your mouth and see if there's any abnormalities. Okay, everything is intact. There's saliva present. Now I'm going to move your tongue to one side to look behind, like almost underneath your teeth, to see if there's abnormalities or any ulcerations. No. Okay, nothing over there. No nodules. Everything looks intact. Okay. Can you take another sip of water? I just want to make sure that your gag reflex is intact. Okay. It is intact. The next part of our physical examination, we're going to test your eyes using the Snellen chart. It looks something like this. I'll have a copy hanging on the wall and have you reading the top letters and some of the bottom letters to see how good your vision is. Okay, can you cover your right eye for me? Okay, so it's going to be from about 20 feet away, so I'm going to go over here. Okay, can you tell me the first, the top letter on the chart that I'm pointing to?
E.
Okay, and the very bottom letter?
L.
Uh-huh. Next
E.
one? Mm-hmm.
E.
Okay.
D.
Okay, now switch eyes. Okay, so from 20 feet you were able to see with your left eye. Now testing the right eye. Can you tell me this letter?
O.
And next to that?
Z.
Okay. And then directly below it?
F.
And next to it?
P.
Okay. So you're able to see with both eyes from 20 feet. And next thing I will examine with your eyes is the nearsighted vision. So I'm going to have you cover each eye like this. And I'm going to test your peripheral vision.
Okay.
Okay, so cover your right eye. You see this?
Mm.
Do you see my finger?
Yes.
Do you see my finger?
No.
No?
Yes.
Okay. Now switch eyes. Do you see my finger?
Yes.
How about now?
Yes.
Now?
Yes.
No?
No.
Okay. Okay, so that's also known as a confrontation test. Okay. Okay, right now I'm going to hold a pen light in my hand and see if you can follow the pen light with both of your eyes, and it's going to be testing the normal response of the parallel tracking of both of your eyes. So see if you can follow my hand with both of your eyes at the same time. Okay, both of them are moving at the same time. That's good. Okay, and that is a normal finding for your eyes. Next, I'm going to look into your eyes and see the size of your pupils. And see and also observe your gaze. Okay. Okay. They're both reactive to light. And now I'm just going to look at the external structure of your eyes. Both of you, can you open your eyes wide for me? Okay, they are both symmetrical. There is no discharge. Your eyeballs are aligned normally in their sockets. Let me see, your sclera is slightly reddened. There's a few blood vessels apparent. Under your eyes, your conjunctiva is a little bit red. Could be because you're tired. Okay, and now I'm just going to look at the top of your eyes for any swelling or lesions. Okay. All right. Okay, no abnormal findings. Okay, this almost completes your exam. As far as your eyes go, your pupils are equal. They're both reactive to light. They are the same size. The response to light is brisk. Accommodation is equal. And as far as your visual fields, it seems that everything is intact. But do you have any difficulty seeing different colors, or you've always been okay with that throughout your life?
I'm okay with that.
You're okay with different colors. Okay. Lastly, for this part of the exam, I'm just going to finish up the exam with vital signs. I know we did them prior, but I just wanted to check them one more time, as I'm not sure that it was part of the recording. Okay, so for your vital signs, I'm just going to take your temperature of the ear thermometer. Okay, 98.3 degrees Fahrenheit. Your respirations, I'm just going to monitor them. I have this stopwatch here. Okay, I'm going to start in 10 seconds. Just breathe as you normally do. Okay, your respirations for 1 minute were 16. I'm going to just take your pulse. Okay, your pulse right now is 82. Okay, I'm just going to make sure that I hear the same pulse, the apical pulse, by listening to your heart. Okay, very close. 79. And now I'm just going to take your blood pressure really quickly. Are you having any pain? Okay. And we can't take your oxygen rate because we don't have that machine here. But you're breathing okay?
Mm-hmm.
Okay. Sorry about that. Working. Okay, sorry that it's getting so tight. Okay. 110 over 72. Very good. Write that down. Okay. And lastly, I think I forgot to ask you, how tall are you?
5'10".
5'10". And about how much do you weigh?
255.
250. Okay, thank you so much for your time.
Thank you.
All right, see you soon.